This is Josh Halls with MSN 572 doing the respiratory and chest assessment. This is Jessica. I'm just going to ask for a quick consent.
Yes.
Okay, and then I'm going to come into the room, sit down, and do the assessment. Wash my hands. All right, Jessica, my name is Josh. I'm going to do your assessment today on your respiratory. The first thing I'm going to do is I'm just going to kind of watch you breathing. What I'm looking for is just making sure that your chest is symmetrical as you're breathing in. Kind of look at the back as well. And everything seems to be looking normal as she's breathing. Okay, what I'm going to have you do as well is I'm going to have you look that way. Turn your whole body, if you will. Just go ahead and breathe in for me. Chest is symmetrical. Can also count our respirations here. Respiration is about 16. Okay. Now, what we're going to do now is we're going to just kind of, you can go ahead and turn back around. We're going to just look at the fingers, look for any clubbing, look for anything out of the ordinary, cyanotic, anywhere on the body, in the lips, fingers. I'm just going to take a look here. So there's no clubbing, nothing out of the ordinary with the hands. There's no cyanosis around the lips. When someone is struggling for oxygen, you'll see it around the lips especially. Respiratory effort is normal. Chest seems to be the AP diameter of normality there, so nothing, again, nothing out of the normal there. So now we're going to move to palpation. Again, I'm going to have you turn your body that way, and what I'm going to do is we're just going to look for respiratory excursion here. So I'm going to have her take a big deep breath in and hold it. And I'm just going to palpate here. Right there. Okay, now I'm going to have you breathe out. Breathe in normally. And then I want you to breathe out as far as you can and just let it out there, okay? We're listening for that resonance sound for the excursion. About 4 centimeters there, which is in the normal range, okay? We're also, what I'm going to do now is I'm going to use my hands like this, and we're going to look for any tactile freminess. Okay, I'm going to have you just say the words 99 for me.
99.
Okay, one more time.
99.
Okay, perfect. We're also going to check the anterior portion of this. Again, using hands that are comfortable to the patient. Go ahead and say 99.
99.
And one more time there.
99.
And that all seems to be within normal limits for the patient, nothing out of the ordinary there. Okay, and I'm also palpating for some costochondral tenderness, seeing if there's any pain there around the rib cages. Any pain or tenderness?
No.
Perfect. Okay, now what I'm going to do is I am going to palpate using my middle finger and tapping again, kind of like I did for the respiratory excursion, just doing for any resonance, any dual sounds in the lungs. And I would do that on the anterior side as well. But all of that sounds to be resonant, nothing out of the ordinary. Everything is looking and sounding good with the palpation. Okay, now what I'm going to have her do is, while she's got her back to me, we're going to start doing some listening. We're going to do the listening in the ladder formation, where we start on one side and do side to side, and then going down, side, down, side to side, okay? What I want you to do is just take some deep breaths in for me, okay? Perfect. All lungs are normal, normal sounding. I'm going to have you go ahead and turn back around and face the camera forward. We're going to do the same thing here, just listening to the lungs. Perfect. Again, lung sounds and anterior and posterior sounding normal, sounding just like lungs should sound like. And now what we're going to do is I am going to listen for some hyporesonance or blanking on the word. It's eugophony or bronchophony. So I'm going to listen and have her say 99. Okay. What I'm listening for is if it is positive, we'll be able to hear the 99 really well. If it's negative, then it'll kind of be jumbled up for us. Okay. While you're just go ahead and say 99.
99. 99. 99. 99.
And this patient that is negative, you can't really hear what she's saying through the bowel sounds, so the lungs are open and clear. Are you having any shortness of breath, any chest pain as you breathe?
No.
Okay, perfect. All right, that is my chest, lungs assessment.
Thank you.